So welcome back to our Parenting Today lecture series. We are on week 6, part number 2, beginning our discussion talking about the work of Dr. Vern Begston, who is a professor of social work, very esteemed faculty research associate with the School of Social Work at the University of Southern California. He's published over 16 different books and over 260 research articles, including longitudinal studies of generations. And Dr. Begston has uncovered different types of relationships between parents and adult children. So talking about parent and adult children relationships, research tells us that regardless of income, age, or gender, mothers are more likely to have tightly knit relationships with their adult children than fathers. European Americans are more likely to have detached relationships between parents and children than African Americans or Latinos. And parents give more to children than children do to parents. In terms of conflict between parents and adult children, both parents and adult children want to be close and are disappointed when they're not. 1/3 of parents report not being close to adult children. 2/3 of parents of adult children relationships have more than one area of conflict, and 8% have ambivalent feelings about the adult child. In terms of special circumstances in adult development, what is an adult? As adolescents become adults, well-being and self-esteem improve, anger and depression tend to decrease, and substance abuse increases, then declines over the period of the 20s. So some serious psychiatric diagnoses emerge around this age. Schizophrenia, the average age of onset is 18 for men and 25 for women. Obsessive compulsive disorder is another serious psychiatric disorder that emerges around 10 to 12 years, and then again there's a period of emergence around 18 to 23 years. Bipolar disorder tends to emerge in late teens, early adulthood. Bipolar disorder, formerly known or otherwise known as manic depressive disorder. This right here is a graphic depiction of age of onset in schizophrenia in years. This right here, a graphic depiction of bipolar disorder. Talk about severe mental illness. Why do you think this is the age when first episodes occur? Well, research tells us that probably due to increased stress related to transitions, parents tend to have less contact, offer less support to adult children. Mentally ill parents, 4 to 7% of United States adults have a diagnosable mental illness in any given year. It's also important to note that 40% of U.S. adults have a mental illness over a lifetime, and more than 9% of children live with a parent with a drug or alcohol problem. Mentally ill parents may lead to poor detachment, improper discipline, dysfunctional interactions, and less support. It increases risk for mental illness, addiction, or behavior problems for children, though most develop coping skills to be able to deal with a mentally ill parent. Helping children to recognize that a parent is ill helps to minimize the negative consequences. Another important topic is developmental disabilities in adult children, especially with autism spectrum disorder being on the rise in the United States. So children that have developmental disabilities tend to be well supported in childhood, but less so in adulthood. So special education services helps 85% of disabled children. That includes vocational training, independent living skills, self-management of behavior. So, the criticism here is that a lot of these services tend to be age-based and not needs-based. Developmentally disabled adult children tend to decline in numbers entering residential care. There's better pharmacy to control behavior. We need better community-based care. So who provides care for adults that have developmental disabilities? Well, research tells us it's usually women, especially mothers. They find care work rewarding, may experience mourning, stigma, or shame, and really need support. So now moving on to talk about another really important topic. We could see that all of these topics could be actual courses in and of themselves. All are really worthy of important consideration. Talk about parents as grandparents. Grandparents are important sources of support to parents. They improve intergenerational closeness, family storytelling. They can be playmates for children, serve as coaches, important because they can pass on values to subsequent generations. It's a chance to redo mistakes in parenting, provides grandparents with a sense of purpose. They can broker the peace between parents and children. Dr. Gail Sheehy, really important researcher when it comes to modern day grandparenting. Dr. Sheehy said, in order to be an effective grandparent, grandparents should offer support and not advice, and wait your turn with time for grandchildren, and use modern tools for communication, such as some of those Skype or other webcam-based platforms or apps. On parenting parents, there tends to be an ageist concept where children never become parents even when they become caregivers. Aging parents tend to be healthier and wealthier, often giving more to adult children than they get in return. And there is a distinction among older adults, which we're going to flesh out and describe here in the course. So there's that young old in between the ages of 65 to 74, which are in that third age of parenting. There's the old, which comprises roughly parents or grandparents that fall in that category between the ages of 75 to approximately 84, still falling in that third age category. And then there's the oldest old, 85 years of age plus, which fall into that fourth age. So in terms of caring for older parents, that third age, typically categorized as a time of good health and vitality in older adults. And that fourth age is when the older adults tend to increase in frailty and disability. And we remember that it's defined by function, not by age. So onset usually in the oldest old age group. The parents in that fourth age tend to need care and or supervision, whether that is from their children or from, more formalized care structures. So adult children as caregivers, the ability to provide care to aging parents is influenced by a myriad of factors, including divorce, geography, decreased birth rate. So caregiving responsibilities usually fall on spouses, specifically daughters. Daughters provide instrumental care. Sons tend to provide financial support, statistically speaking. So where do older parents go when they need care? When parents need care, they move in with children. That's the most common scenario here in mainstream United States culture. Hiring in-home care is another option, and moving to residential care, long-term care, which can be extremely expensive. So sketched below here is the long-term care continuum, with older adults moving from independent living to assisted living to nursing home care to hospice. So redefining the family. Family structure, as we discussed and explored earlier in the course, has really changed over the years. So we're talking about extended farm families, which was typical in the United States in the late 1800s, based on that agriculture or agrarian economy. Nuclear families were in the late 1800s to early 1970s, really defined by industrialization and urbanization here in the United States. There's really a diversification of family forms from the 1970s to present. Lots of social changes have taken place, including the civil rights movement, the feminist movement, the Stonewall Rebellion, the gay rights movement. Many trends in the modern era. There's a real secularization here. So there's a focus on increased self-interest and self-growth. Overall, there's been a delay of marriage, delay of having children due to birth control and other factors, an overall increase in premarital sex, increased lifespan, increased rates of divorce, remarriage, and living together instead of opting to marry. There's a growing acceptance overall in mainstream culture to have out-of-wedlock children. And in recent decades, the traditional family structure has changed. So there's more single parents, adolescent mothers, gay and lesbian parents, adoptive parents, as well as grandparents raising grandchildren here in the United States. Talking about single parents, in 1960, 9.1% of children lived in single parent homes, and in the year 2008, 27% of children lived in single parent homes, with 23% of children in the United States living only with the mother and 3% of children in the United States living only with the father. So there are some racial differences that are noted in this research. 16% of white children live with a single mom, with 50% of Black children or African American children living with a single mom. So single parents have higher rates of children living at or below the poverty level. In single mother households, 43% are living at or below poverty level. In single father households, 13% living at or below the federal poverty level. And in married coupled households, 8% living at or below the poverty level. So children of unmarried parents tend to statistically have more academic problems, more problem with peers, tend to be diagnosed with anxiety and mood disorders at a higher rate, and have or display noncompliance in adolescence. So from 6 to 11, higher socioeconomic status tends to counteract these problems. However, in adolescence, socioeconomic status does not matter. There are some protective factors here. So child's characteristics are temperament, attentiveness, and pro-social factors serve as protective factors. Mother's characteristics, the efficacy, low risk for depression. So mom not being depressed tends to be a protective factor. Parenting qualities, in particular, positive parent-child relationship, father's involvement tends to be a protective factor. Having social support, having low life stress, as well as a lack of harsh discipline, tends to be very predictive of later well-being and an additional protective factor here. So we're going to end this part of the lecture series. I look forward to seeing you in part 3.